So today's class is on postnatal care. What is natal period? What is postnatal? Intranatal? Familiar with these terms? आप बताइए. What is postnatal period? What is natal period? And intranatal? Pregnancy. Yes. So sit down. So today's class is on postnatal care. What is the period of postpartum period? कितने वीक्स का होता है? पोस्टपार्टम डिलीवरी के बाद जो पोस्ट नेटल पीरियड होता है 6 weeks. So the pregnant female after delivery, she is in postpartum period for 6 weeks. So how many physical examinations are necessary? Twice a day during first 3 days and then once a day till umbilical cord falls off. At the end of 6 weeks, again examination by gynecologist. This is for involution of uterus because at the time of pregnancy uterus has increased in size and after delivery there is involution, that is decrease in size of uterus. So after 6 weeks there should be involution of uterus. Then visit once a month for next 6 months and thereafter once 2 to 3 months till the end of 1 year. So apart from this general physical examination, we look for anemia, signs of anemia, advice regarding nutrition and dietary history is taken. Some postnatal exercises are advised for speedy recovery. Then breastfeeding, history of breastfeeding and the correct posture and other problems regarding breastfeeding are discussed and family planning advice is given. If she is interested during lactation period, then contraceptives which can be given to a lactational female, they are advised. कौन से contraceptives दे सकते हैं lactation period में? Hormonal OCPs, they are contraindicated during lactation period. So progesterone only pills, they are given. Then birth weight. This is the single most important determinant of its chances of survival, growth and development. So the minimum birth weight, it should be 2.5 kg. Less than that, it is known as low birth weight. And low birth weight babies, they are at risk of many diseases and they also achieve milestones later than their age. So this is the single best measure of physical growth and it is measured in first hour of life. Average birth weight in India is 2.8 kg. Now major cause of low birth weight is maternal malnutrition associated with fetal growth retardation. Relationship between maternal nutrition and birth weight of babies is linear. Linear means if the nutrition of a pregnant female is good, then the birth weight of baby will be average or above average. Smoking, it reduces birth weight by an average of 170 grams. But low birth weight is not in contraindication to any vaccine except hepatitis B. So all vaccines can be given to a low birth weight baby, that is a baby of weight less than 2.5 kg, except one vaccine, that is hepatitis B. Then there are certain congenital disorders among newborns and the incidence of These congenital disorders is 30 to 70 per thousand live births. And out of these, most common is cardiovascular and nervous system disorders. Then birth defects are seen in about 2.5% population, and it rises to 4% if they are followed up to the age of 4 years, because some of the congenital disorders, they manifest at a later age. They don't manifest in a newborn baby. Most common birth defects in North India is neural tube defect or spina bifida, and in rest of India it is musculoskeletal disorder. Now about low birth weight babies. As I told you, birth weight less than 2.5 kg, irrespective of gestational age, and prevalence in the world is 15% and in India is 18%. And if the cutoff value is reduced to 2, then the prevalence in India will be increased to about 5.5%. Now there is another term, SFD, small for date babies. Why these backbenchers are talking so much? क्या discussion हो रहा है आपने? Last 3 benches. So SFD, small for date babies, they are born at term or post term, and they will less than 10th percentile for gestational age. So term means how many weeks? Yes, 40 weeks is the term. 42 is post हो जाता है 2 weeks, और after 37 weeks delivery can be done because baby is fully matured. But जो pregnancy का period होता है that is 40 weeks. So these babies, they are born preterm, before 37 weeks, at term or post term, and as a result they are growth retarded. So there is a risk of dying. Now rate is calculated for mortality, that is infant mortality rate, and it is calculated as number of infant deaths in a given year divided by total number of live births into 1000. And IMR, it denotes the socio-economic status of a country. But the best indicator is under 5 mortality rate. Now what is an infant? Infant is up to 1 year of age. So here we are calculating only those deaths which are up to 1 year of age. But if we take into account under 5 mortality rate, that is children up to 5 years of age तक कितनी deaths हुई हैं, then that will be a better indicator of socio-economic development of a country. So IMR is most important indicator of health status of community, level of living, and effectiveness of MCH services in general. So currently in India, IMR is 39 per thousand, and in world it is 42 per thousand. Now there are various factors which affect infant mortality rate. Most important is birth weight, which should be more than 2.5 kg. Age of mother should be at least 18 and should not be more than 35, because after 35 the pregnancy is considered as high risk pregnancy. There is risk of congenital disorders. Birth order, greatest at birth order 1, least for 2, and increases 3 onwards. Birth spacing is important. If the spacing is less than 2 years between 2 children, then there is a risk. Multiple births, family size if it is big, and high fertility rate, these are the adverse factors for IMR. Economic factors, cultural and social factors. Breastfeeding is a favorable factor. It will decrease infant mortality rate because of decreased risk of many diseases. Religion and caste. Certain cultural factors and social factors, depending on the various religions and various castes, they follow certain cultures which led to higher rate of infant mortality rate. Early marriage is a risk factor. Then other factors. IMR is more for girls as compared to boys. Quality of mothering, quality of health care, maternal education, broken family, untrained eye, and bad environmental sanitation. These all are uh, favorable, that is, they increase infant mortality rate. Now about neonatal mortality rate. Neonatal is बर्थ से लेकर 28 डेज तक का जो पीरियड है दैट इज कंसिडर्ड एज नियोनेटल पीरियड. So number of neonatal deaths within 28 days per 1000 live births. This is how we calculate neonatal mortality rate. Then there are two terms, early neonatal mortality rate and post neonatal. Early is within 7 days and late is up to 1 to 4 weeks and post neonatal is जो 28 days के बाद का period है, that is post neonatal period. So if we talk about India, neonatal mortality rate currently it is 26 per 1000 live births and it is more for boys as compared to girls, and the most common cause is preterm birth. Preterm, that is before 37 weeks of pregnancy. Prematurity, congenital abnormalities, they may lead to increase in neonatal mortality rate, and some infections like diarrhea, tetanus, which occur in newborn, they led to increase in mortality rate. So all these are the causes of neonatal mortality. Low birth weight or prematurity, birth injury or difficult labor, sepsis, congenital anomalies, hemolytic disease of newborn, it is a genetic disease, conditions of placenta and cord, diarrheal diseases, acute respiratory infections, and tetanus. All these are causes from first day of life to 28th day of life. Now something about breastfeeding. Exclusive breastfeeding, it should be practiced till 6 months of, till the new baby is 6 months of age. Now exclusive means not even water should be given. If the baby is ill, medicines can be given, but water it should not be given. Any solid or semi-solid food, that should also not be advised. Breastfeeding should be continued till 2 years of age. Maximum output is seen in 5 to 6 months when the baby is 5 to 6 months of age. That is 730 milliliters per day. And the energy content of breast milk is 65 kilocalorie per 100 ml and protein content is 1.1 gram per 100 ml. ये सब आपके एमसीक्यूज में आ सकता है या वाइवा में पूछ सकते हैं. व्हाट इज द एनर्जी कंटेंट और प्रोटीन कंटेंट ऑफ ब्रेस्ट मिल्क. Human milk is rich in carbohydrate, iron and water content, and cow milk is richer in fat, protein, calcium and energy content. The proteins which are present in human milk, it has more of cysteine, taurine and less methionine, more PUFAs, that is polyunsaturated fatty acids, linoleic acid, linolenic acid. Vitamins and minerals, it is rich in vitamin A, vitamin C, copper, cobalt, selenium, rich in iron, and they have higher bioavailability. Bioavailability is higher means intestines या stomach से जो absorption होगा in nutrients का, that is higher. So we say the bioavailability is higher. Now colostrum. Colostrum is the first milk. Breastfeeding, it should be initiated within half an hour of normal delivery and 4 hours of cesarean section. Most suitable food immediately after birth is breast milk. But for first 3 to 6 days, that is the breast milk is known as colostrum, and after that regular milk comes. High in carbohydrate, proteins, antibodies, and it is low in fat. It contains all the five immunoglobulins. So it is very important for immunity of newborn. Few occasions when breastfeeding might harm the infant if the infant is having galactosemia, which is a genetic disorder. Mothers with untreated pulmonary tuberculosis, because it is an infectious disease and breastfeeding में पास कर सकती है मदर बेबी को. So at that time, if she is having untreated pulmonary tuberculosis, then breastfeeding is not advised. Mother taking medicine that suppress immunity. Now, immunity, it can be suppressed by steroids or anti-carcinoma drugs. Mother having exposure to heavy metals like mercury, having HIV, mother taking potential harmful substances like cocaine, heroin, amphetamines, all these are secreted in breast milk. Now about growth and development, how they are monitored. So there is a growth chart where we plot height and weight of the baby from birth to 5 years of age, and there is a normal curve in that chart. तो जिस बेबी का रिकॉर्ड होगा वो हाइट और वेट उसका एक कर्व बनेगा फ्रॉम बर्थ टू 5 years ऑफ एज, एंड दैट कर्व शुड कोइंसाइड विद द नॉर्मल कर्व. अगर वो उससे नीचे आ रहा है, दैट मीन्स द बेबी इज गोइंग टूवर्ड malnutrition, and accordingly dietary changes are advised or therapeutic advice is given. So weight is the single best parameter for assessment of physical growth, most sensitive, and reflects only the present health status. Then weight for height. Weight for height means at a particular height इतना weight होना चाहिए उस बेबी का, तो उसका एक पूरी एक टेबल होती है टू बी मैच दैट अकॉर्डिंग उस बेबी की जितनी हाइट है उसके अकॉर्डिंग उसका वेट होना चाहिए. Height is a stable measurement of growth as opposed to body weight. It indicates events in the past also. So long term जो effect पड़ता है, that is reflected in height of that baby. Acute and chronic malnutrition. Low weight for age. The baby is known as underweight, and it may be because of acute as well as chronic malnutrition. Low weight for height. It indicates nutritional wasting, and it is because of acute malnutrition. And low height for age, it is because of chronic malnutrition and leads to nutritional stunting or dwarfing. So birth weight average, it is 2.8 in India, less than 2.5 is low birth weight, and its prevalence is 18%. Birth weight doubles every 6 months, triple by 1 year, and quadruple by 2 years. So by measuring the birth weight of a baby, the growth can be assessed. Then birth length in India, it is about 50 centimeters. Height increment in the first year is 25 centimeters, second year 12 centimeters, थर्ड ईयर 9 सेंटीमीटर्स एंड फोर्थ ईयर 7 सेंटीमीटर्स. ये सब आपको याद रखना पड़ेगा. अगर पीडियाट्रिक्स में जब आपकी क्लिनिकल पोस्टिंग होगी तो फिर से आपको ये सब काम आने वाला है कि वहाँ पे जो आपको केसेस मिलेंगे उनको आपकी ग्रोथ उनकी एसेस करनी होगी, या मेल नरिश्ड कोई बेबी मिलेगा तो कितना मेल नरिशमेंट है. सो ऑल दीज फिगर्स यू हैव टू लर्न. So growth chart is also known as road to health chart, developed by David Morley. It is designed for longitudinal follow-up or growth monitoring, and age and weight, their height and weight are plotted in this growth chart. So the information which is provided by this chart is identification and registration, birth date, birth weight, chronological age, weight for age. Developmental milestones are also recorded in this chart, and the supplementary foods which are being introduced to that child, they are also recorded. There is another growth chart, WHO home-based growth chart. It has two curves. Upper reference curve indicates 50th percentile for boys and lower reference curve, that is for girls. So two curves in the same chart, one for boy and one for girl. Government of India recommended growth chart, and it is used by Anganwadi workers at Anganwadi centers, and it has four reference curves. 80% of median, 70% of median, 60% of median and 50% of median. तो ये चार कर्व्स उसमें पहले से बने होते हैं, और जिस बच्चे का वहाँ पे रिकॉर्ड होता है आंगनवाड़ी वर्कर रिकॉर्ड करती है उस पर, और हाइट और वेट का एक कर्व बनाती है, और अगर वो नॉर्मल कर्व से नीचे है दैट मीन्स द बेबी इज गोइंग टुवर्ड्स malnutrition. It is a passport of child health care, best available standard for growth, and the objective of maintaining this growth chart is to keep the child above third percentile, that is above average. It is a growth monitoring tool, diagnostic tool for identifying high risk children, that is those which are malnourished, planning and policy making, educational tool, tool for action, tool for teaching. So that was all about postnatal care. Any questions?